Hello friends. Today we are going to discuss about ethics in counseling. I'm Dr. Suresh Badmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about what is counseling, what is ethics, what are the ethics we should follow when we do counseling, and the code of conduct. These are the important issues which will be discussed in this video. Let's understand about counseling. There are various types of counseling, but I'm talking specifically with regard to mental health counseling, and counseling related to emotional or crisis related counseling. If you look at the American Counseling Association, they defined counseling as a professional relationship that empowers the diverse individuals, families, and groups to accomplish mental health, wellness, education, and career goals. So, that is the holistic definition of counseling as per American Counseling Association. Counseling is also a process of assisting and guiding the clients, especially by a trained person, on a professional basis to resolve especially personal, social, or psychological problems and difficulties. This is how the counseling has been defined. Counseling is not giving lecture, it is not giving information. Counseling is resolving the psychological, personal, and social problems by empowering the clients. That is the simplest way of putting across what is counseling. Here, it is also considered as a process that occurs when a client and a counselors set aside a time to explore difficulties, which may include stressful and emotional feelings of the client. So it is specifically relating to the client. Now let's move into ethics in counseling. Before we move, we need to know what is ethics. Ethics is a set of principles or guidelines that govern the behavior of an individuals or groups, determining what is considered right, wrong, or just or unjust. That means it's not a law, but these are principles. It can be moral principles or it can be guidelines which determines the individuals or groups whether it is right, wrong, good, or bad. Further, if you look at the ethics, it involves the study and application of moral values, obligations, and rules that guide human conduct in various contexts such as interpersonal relationships, professional relationships, and society at large. Ethics is not just only medical, it applies across all fields. That means, what are those good principles which we are going to follow when we are providing counselings? Ethics helps from the professional perspective, that is, individuals to make decisions that aligns with the shared principle of fairness, responsibility, and respect for others. That means we are here as a counselors to help the patient or the clients to make their decision. You are not going to give the decision, you are helping them to make their own decisions based upon a very important ethical principle, that is fairness, responsibility, respect for others. That means autonomy. You are going to say, yes, this person is able to take the decision. It also provides a framework for evaluating the actions of the therapist, resolving the dilemmas, and promoting accountability in the therapist. That means it is a larger perspective. Just because you have read about counseling, you cannot become a counselor. You need to know about the ethics. What are the moral values? What is right or wrong? What is the licensing? What is the registration process? What is the education you need to undergo? so that you can do counseling. Ethics is also defined as a moral principles guiding the behavior to distinguish between right and wrong, influencing the individual's behavior, and also societal decision making. Ethics is influenced by various factors in the society. Hence, ethics is dynamic in nature. That means the code of principles of ethics, which will be encoded now, may become redundant over a period of time. Ethics evolve as the society evolves, scientific temperament evolves, new evidence comes in. But however, some of this ethics principle continues to be there endlessly. At the same time, ethics can be read into law also. For example, especially in doctors, they had taken Hippocratic oath as an ethics to care for the patient. That means in a emergency they will provide care. Unfortunately, over a period of time, many of them forgot that to provide care during emergency or in a crisis situation, the Supreme Court of India has to intervene and has to say, look, doctors, you have taken Hippocratic oath telling that you are going to provide care during the emergency. And in a landmark judgment, Permanent Kataria versus Union of India, it clearly said that this ethical obligation has become a legal obligation to provide care during emergency. That means these ethics, if we do not follow over a period of time, the society, the lawmakers will make a legal obligation casted upon the various professionals. Now let's look into the various factors which influence ethical practice and code of conduct. First and the foremost, the factors which are going to influence our societal norms, religious factors, and cultural values. What does it mean? As the society moves forward, the ethics norms, rules, and regulation also changes based upon various religious practices. You need to keep in mind how you're going to behave with the client. That means their religious practices may be different and your religious practices may be different. You cannot impose your religious belief on the clients. Similarly, with regard to cultural values, if the patient do not prescribe for certain cultural values, do not impose them or do not judge their cultural values are bad. Further, the therapist moral values also play a role. Over a period of time, the group of therapists may form an association. Their moral values can be coded into professional ethics. Legal framework. For example, if there is a child sexual abuse, there is a confidentiality as an ethics. But the legal framework says you need to inform the police under POCSO Act of 2012. That means Protection of Children from Sexual Offense Act of 2012. In section 19 is very clear. You need to inform the police. If you don't do, then means 6 months imprisonment for the therapist. That means even our counseling is also bound by the legal framework. Professional code of conduct. That means what does the professionals which we are assigned to, for example, doctors, what are their code of conduct? Similarly, the counselors are now under the allied healthcare profession. That means they are need to follow the professional code of conduct of Allied Healthcare Act. Similarly, historical and philosophical foundation. For example, in India, what is the history? What are the cultural values? What are the philosophical foundation which exists now and which exist in the past will be usually aligned to it. Invariably, the Indian philosophy was duty based earlier. For a period of time, it has become rights. But now there is a dilemma whether we should follow a duty based or a rights based. That kind of dilemma do exist, but historical perspective also is very essential. Further, organizational culture. In which organization you are working, what is their ethics, morality, also prescribes stakeholders' expectation. What is the society's expectation from you as a counselor? So that expectation also is going to dictate ethics. Education and training, whether you have been educated from Western country, maybe Eastern country, or in India. What are those training that may also over a period of time get ingrained into ethics? Technological advancements, especially telecounseling, have brought in newer ethical dilemmas and newer code of conduct. Finally, globalization and cross-cultural interactions. That means the world has become very small, it has shrunk through internet. That means these ethics principles can be borrowed from Western country, can be implanted in the Eastern country, and the ethical dilemma exists. So these ethics, which are considered to be sacrosanct, which need to be followed during counseling, although they are dynamic in nature and they play a very important role in practicing counseling, but we need to adapt to the changes, new challenges, technologies, and if there are cultural variation to occurs. However, please remember, although ethics is dynamic in nature, certain broader principle continues to remain same now also, such as autonomy, fairness, accountability, respect to others or the client remains unchanged. That means ensuring stability continues to be there as an ethical foundation which existed since many centuries. But however, codes do evolve contextually with the change in society and with the principles for modern realities. That means some of the principles continue to be same and some principle changes over a period of time and certain principles need to be interpreted keeping the current scenario of contemporary world. Now let's look into those important ethical principles which are not changed over a period of time. There are six important ethical principles. They are autonomy, confidentiality and privacy, non-maleficency, beneficiency, justice, and boundary violation. These are very important ethical principle you need to follow when you are doing counseling. First and the foremost, autonomy. Autonomy in ethics of counseling refers to the right and the capacity of an individual to make an informed, independent decision about their lives and well being without undue influence or coercion. What does that mean? The therapist will believe the client has an autonomy to make his own decision, and this decision should be informed and he will decide without undue influence by anybody. That means you need to respect the autonomy of the client. It emphasizes the respecting the client's ability to govern their own choices, not to impose the therapist's personal values, judgment, practices, or decision on the clients. This is very simple. If you are a person who is taking vegetarian food or a vegan and a client is a non-vegetarian, don't impose your values on the patient. You need to give complete freedom of choice to the patient or the client. That autonomy should be respected. You are not going to belittle this client and say you cannot take decision. The therapist has to be very clear about that. Autonomy in counseling is about respecting and promoting clients' right to make their own decision, which are informed, independent decision making ability. Under no circumstances you are going to compromise as a therapist. What does it mean? When you are doing counseling, informed consent, helping the client to make self determination, and safeguarding against coercion. These three important things will ensure autonomy. That means if you're going to do anything or tell anything or make, you may ask something to do, to the client, informed consent is essential, and respect, telling that the patient or the client can take their own decision, and enabling them to take their own decision is self determination, and safeguarding against coercion from any person in the society is very essential. Example I would like to give: a client comes for counseling, and the client is a female seeking divorce. Now, as a counselor, you need to respect the autonomy of this person who is a female seeking for counseling. Here, the counselor is not going to give his decision. He should not say that, why are you taking um, divorce? It's wrong. In our culture, it is not accepted. You are not going to make any decision. You should not make any moral judgment also. You need to enable them so that they make their own decision. You need to make sure they are not making decision under the heightened emotion. Hence, ventilation should be proactively done. Once the emotion comes down, the person will be able to think properly. You need to assess and explore the client's values and desires without any bias. You need to discuss about their choices. What are the positive and negative aspect of taking divorce and not taking divorce? In the whole process in autonomy, you need to empower the client for their own decision making. You are not a surrogate decision maker. If you give ready-made answer, then the patient will never be empowered. The patient will be disabled. That is not the goal of counseling. In simple example, counseling is teaching how to fish. That means how to go and catch the fish. Counseling is not giving the fish. If you give the fish, the person will eat, and again you will come back and ask for fish. If you teach how to do fishing, that means you are teaching the skills of being independent to make their own decision, how to deal with their emotion. That is what is all about autonomy. Autonomy means enabling them to make their own decision. Now let's discuss about confidentiality. Confidentiality in ethics is very, very important. It refers to the professional obligation of the counselor to protect the client's private information being accessed by others. It can be medical records, it can be records kept on online, or else the therapist himself providing this private information to others. Confidentiality is a cornerstone of counseling, and it is a building block for therapeutic relationship. Based upon confidentiality, trust is developed so that the client feels safe and discusses about his problem openly. Without confidentiality, no client will come and discuss about their problem. Confidentiality is not absolute at the same time. There are legal obligations and ethical obligations when you need to breach this confidentiality. But confidentiality is very essential to keep the trust, to build the rapport, and so the patient improves by discussing about his problem through ventilation, and he gets empowered through learning various skills during counseling. But however, there are certain exceptions with regard to breach of confidentiality. That means you may have to tell the patient or the client that in certain situation, confidentiality will be broken, privileged communication will not be there. For example, if the patient or the client says he's going to kill himself, suicide or a homicidal threat, in such a situation, you need to inform the police. Voluntary disclosure. That means the therapist need to inform whenever there is a cognizable offense done by the client, or else the client is involved in an abusive relationship, or the client himself is abusive, or even the victim. But you need to balance the need to report versus confidentiality. However, certain laws makes an obligation, that is legal obligation, mandatory disclosure, especially in prevention of sexual abuse in children. Act 2012. In such situation, you are obligated to inform the police whenever there is a child sexual abuse. Similarly, whenever the court summons the medical records, you have to inform the client. Whether the client gives the consent or not, you have to submit this report to the court of law. And finally, during training and supervision, imagine you are undergoing training. You need to discuss this with your supervisor. In such a scenario, you need to take consent from the client and say, I'm a trainee, I'm undergoing training, and I'll be discussing with my supervisor. In such a scenario, the confidentiality will not hold good. Finally, professional disclosure for continuity of care. For example, if you are treating a client and he has an heart attack, you need to take him to the hospital and you need to inform the treating doctor about important issues which may would have led to heart attack or any other health issues which may be beneficial in saving his life. That means in the professional manner for the continuity of care, it is allowed. Please remember, again, I'm repeating, confidentiality is not absolute. Reasonable restriction do exist. But counselor must weigh the need to maintain confidentiality against the duty to protect the society or others. That is, individual rights of the clients versus the individual rights of the society at large should be considered. Based upon that, the therapist need to take a decision. But however, transparency with the client about confidentiality, limitation of confidentiality had to be discussed so that the patient knows about the confidentiality and the limitation, and he will have a trust with the therapist. The third one is NonM Efficiency. What does it mean? In simple terms, do not do any harm to the client. It emphasizes the duty of the counselor to avoid causing harm to the client. What does it entails? It entails of providing competent care, maintaining boundaries, carefully considering the potential risk of intervention. For example, if you are not trained in family therapy, that means you are not competent. Do not do counseling with regard to family issues. That is about NonM Efficiency. That means you are not going to do harm by doing family therapy without knowing what is it. If you're not trained in DBT, dialectical behavioral therapy, don't do DBT. That means if you're not competent enough, you should not do. Maintaining boundaries. You're not going to violate boundaries, take advantage of the client, and misuse him. And you need to carefully consider various interventions for the benefit of the patient. But however, sometimes therapeutic discomfort do occur. For example, the patient is anxious or he has social phobia. You need to exposure. If you need to expose him, and during exposure, he may become anxious. Although this anxiety may be a discomfort, may do certain little harm in the short term, but in the long term, he gets rid of social phobia. That means certain action taken for therapeutic process is acceptable in NonM Efficiency. Another simple example is the doctor has to do good to the patient. You have to do certain operation. It may be harming to him in the short term, but in the long term, he will be cured with the disease. And harm can occur even with good intention. For example, you want to do therapy and you are trained, and many a time the therapy may not work. And you need to weigh the risk of improving, not improving, worsening. And hence, as a counselor, you have to be vigilant about the potential risk and evaluate, and you need to evaluate the approaches thoroughly, and as if required you need to refer to the higher centers. That is about non-M efficiency. The fourth one is beneficiency. Here, do best to the client. That is, acting in the best interest of the client. This obligation is to do good to the client by promoting well being, preventing harm of the client, advocacy for the client, acting in a way which enhances the physical, emotional, and psychological well being of the client. With beneficiency encouraging helping the client, it must not override the autonomy. What does it mean? For example, if the beneficiency with regard to patient is taking medication, but the client or the patient says he does not want to take medication, you are not going to force him to take the medication. That is where the beneficiency versus autonomy, sometimes these ethics conflict do occur. In such a scenario, the higher ethics should dictate over the lower in the order. Many a time you need to balance between non-maleficence and beneficiency. For example, as I mentioned earlier, if a patient has OCD and he needs to get rid of OCD, that means he has to do ERP, that is exposure and response prevention. During that time, he may have increased anxiety and panic attacks, but in the long run, he will get rid of OCD. So, my dear friends, beneficiency is basically doing good to the client. Fifth one is justice. Justice in ethics, particularly with the context of counseling, refers to the fairness and equality. Let's discuss in detail about that. It demands the counselor treats the client with impartial, ensuring that all client receives equitable care, access to services, non-discrimination, and fair treatment. This is regardless of the background, identity, religion, geography, sexual orientation, and gender identification. That means you have to do justice and you are not going to discriminate from one client to another client. However, many a time justice may come in the way of beneficiency. For example, there is a crisis and a client is about to commit suicide, and you have not given any appointment to him, but you have given appointment to some other patient. In such a scenario, you need to play a role by beneficiency by providing care for the person who is in emergency crisis. During that time, you are not going to talk about justice. Justice will be whoever has taken the appointment should be seen first, but the beneficiency says that the person who needs at this point of time should be given first. So, my dear friends, this ethical conflict do occur between the various important ethics. So you need to keep in mind. And the finally is boundary violation. In the contemporary world and in this digital world, boundary violation is becoming the norm. Let's understand this. Boundary violation in counseling occurs when a professional who is doing counseling crosses the boundary and compromises the integrity of therapeutic relationship. What does it mean? Let's understand that. Here the boundary violation is professional boundaries is the professional relationship between the client and the therapist. And sometimes the therapist will cross the boundary and will have non-professional relationship. For example, the client is coming to see you as a therapist. Later you come to know he's a real estate agent. Now you want to buy a house. Now you are entering with a non-professional relationship also. Many code of conduct prohibits that. You need to have only professional relationship with the client, sexual and non-sexual relationship. Sometimes some of the therapists will take advantage and engage in sexual activity with the patient. Sometimes it may be non-sexual, it may be just flirting with the patient. Sometimes physical relationship with the patient, touching them inappropriately, non-physical, for example, shouting at them, or else going out for a trip with the client. Sometimes it may be financial and non-financial. Financial is taking money beyond what is discussed earlier as a remuneration, or asking for gifts, costly gifts. So these are all called as boundary violations. Hence, these have been classified into physical boundary violation, unnecessarily touching the patient, emotional, getting carried away with the patient, and doing certain things which is not warranted, which will be detrimental to the client, on virtual, flirting with the client, becoming friend on social media, sending messages to the client, and the client sending messages to you, engaging in sexual activity with the client, non-professional, becoming friend, developing business partnership, doing business with the client. Financial, it can be money, it can be consideration, it can be gifts, and finally, related to confidentiality, by threatening the patient, sharing the client's information to others. So these are the boundary violation you need to keep in mind. But unfortunately, sometimes dual role you are going to play. For example, teacher in a college is also supposed to do counseling. So she has a dual role, one as a teacher, another as a counselor. Similarly, a psychiatrist who is doing treatment at the same time, he also has to do counseling. Another best example would be you are a counselor, but the client is also a relative. So these dual roles sometimes become very difficult to deal. And the boundary violation can occur when the counselor engages in dual relationship, where they have more than one relationship with the client. And this can compromise the objectivity, professional judgment, leading to the destruction and harming to the patient. And you need to keep the conflict of interest in mind and exploitation. One another important thing you need to understand: therapist and a client relationship is a fiduciary relationship. That means the power of the therapist is high, the client is very low. In this power equation, the therapist has to do good at any circumstances. You should not take advantage of the client being at the lower power end. Hence, the boundary violation need to be kept checked. Otherwise, the profession as a counseling will be destroyed in no time. Boundary violation can harm the client. It can cause the exploitation of the client, erosion of trust, dependency of the client, worsening of his symptoms, death by suicide, and finally, destruction of the profession as a mental health counseling. In this regard, you can read the American Counseling Association Code of Ethics, which was released in 2014. There are various other Australian Counseling Association Code of Ethics is there, and many other countries also have come up with that. I'm going to discuss the salient points of American Counseling Association. They have talked about various sections. Section A talks about counseling relationship. In this relationship, the therapist has to uphold dignity, autonomy, and welfare of the client at any cost. Section B talks about confidentiality and privacy. The therapist need to protect the client's information, at the same time explain the client about the limits of confidentiality, and also discuss about how the data will be handled. Section C talks about professional responsibility. That means, as a therapist, you need to be competent, you need to undergo training, and if you come to know that you are not trained enough, you need to refer, adhere to the legal standards, and professional integrity and code of ethics. Section D talks about relationship with other professionals. You need to be respectful with the other colleagues, other allied healthcare professionals, collaborative relationships, and also with other medical profession. Evaluation, assessment, and interpretation is Section E. Here, the therapist need to use the latest available information, assessments which are valid, reliable, and used appropriately for the benefit of the client. With regard to Section F, which comes with regard to supervision, training, and teaching. If you are a teacher or else a supervisor in a counseling college, you need to define your responsibility as a counselor, as a supervisor, as a trainer, and teaching role. You need to explain the client when your trainee takes up for therapy and the confidentiality limitation and how the training is done, which is beneficial both for the client and also the trainee who is undergoing training. Research and publication, section G. Here, the therapist should not publish with regard to research or with regard to patient's life, either online or in commercial media or any other places. You have to be very careful. Confidentiality prevails at any cost. With regard to these kinds of research and publication, distance counseling, technology, and social media. This is section H. As you know, in COVID, the telecounseling became a norm. In this regard, section H dictates how to do telecounseling by using technology, what are the data security measures, how to do online counseling, social etiquettes, and media interaction has to be known. And finally, resolving ethical issues. This is section I. If the client has a complaint against the ethical violation of the therapist, he has all the right to go and give complaint to the professional body. That is, and also the therapist need to discuss with the supervisors or or a supervisor who is going to look after the therapist many a time by providing this counseling, which can be draining many times. We call it as compassionate fatigue. In such a scenario, the therapist can harm the client. So, to keep the client safe, the complaint regarding the violation of ethics need to be given to the profession where the counselors have enrolled or license to practice have been given. Now, what are the challenges, especially in the contemporary world with regard to counseling? First and the foremost, unfortunately in India, unqualified people are telling that I'm a counselor, I'm a life coach, I will do counseling without even undergoing basic counseling skills, basic education. Unfortunate this. And they are charging huge amount of money. In a single setting, they are charging maybe 5,000, some of them maybe 25,000. And for 10 counseling session, I have heard that even 2 lakh rupees have been charged. Many of them are unlicensed, unregistered people, and many of them are harming the clients. Many a time, these counselors who are untrained, who do not know about ethics, online chatting with the client, becoming friends with the client, taking advantage of the client, developing relationship with the client, offline, online, sexual relationship, boundary violation, entering into business deal, taking help, and taking advantage of the client. And many a time, confidentiality is violated. Many of the therapists have posted patients' information online on social media. Further, doing group therapy and family therapy without proper training and confidentiality can become at stake when you are doing therapy with 6 to 7 family members. And now there are laws. For example, Nursing Council of India 1947, National Medical Commission of 2019, and the National Commission for Allied Healthcare Profession Act 2021, Rehabilitation Council Act of 1992, Mental Health Care Act of 2017. All these play a crucial role with regard to counseling, especially with regard to mental health counseling. And of course, even health counseling. That means you need to adhere to this legal framework. You need to be registered in one of these agencies. If you are a nurse, Of course, you will be enrolled in Nursing Council of India if you are a doctor, National Medical Commission Act. And if you are a allied healthcare professional, you will be registering under National Commission for Allied and Healthcare Professional Act. If you are a rehabilitation psychologist, you will register under RCI. And Mental Health Care Act dictates the rights of the client. It can be right for advance directives, right to nominate representative, right to confidentiality, right to maintain basic medical record and access by the patient, right to legal aid, right to make complaint, and bar to practice which you are not trained in certain areas. So all these legal framework has to be kept in mind. In my next video, I'll be discussing about legal issues of counseling. Please keep watching. If you are not registered or licensed to be a counselor, please do register under the National Commission for Allied Healthcare and Professional Act of 2021. There is the clear link has been given, or else you can just type National Commission for Allied and Healthcare portal. You will get this National Health Authority portal where you can register yourself. And if you have any doubt, please go through FAQs. You can write grievance readdressal in the following website, and also you can call them. So please do not practice counseling without undergoing registration. To conclude, my dear friends, counseling is nothing but empowering the client. At the same time, you need to do counseling with ethical practice. You need to have competency to do counseling. You need to register either in the nursing council if you're a nurse, medical council if you're a doctor, rehabilitation council if you're a rehabilitation psychologist, or else you need to register under National Commission for Allied and Healthcare Profession Act 2021 to do counseling, my dear friends. These are the important ethical framework you need to do when you practice counseling. Thank you very much for your valuable time. Stay safe.